Welcome to the High Performance Hockey Podcast. Today we're joined by Dr. Jeff Cubos. Originally from Toronto, Jeff holds a bachelor's degree in physical education and health and a master's degree in kinesiology, the study of human movement. Having a passion for working with elite athletes as a chiropractor, sports specialist, Dr. Cubos has spent over 2 decades working in sport at the community, international, and professional levels, and thrives on caring for athletes of all levels and abilities. Jeff is a friend of mine, fantastic practitioner, an honor to have him on the podcast. We speak about his duties as a consultant chiropractor for the Edmonton Oilers. We talk about this idea that threads through the conversation about being a neo-generalist or a serial specialist. We speak about modalities, recovery modalities at high performance. It's a fantastic conversation. Welcome to the podcast. Welcome to the podcast, Jeff. Thanks so much for joining us.
Thank you, sir. Appreciate it.
It's going to be a great 45 minutes to an hour, scaling a great message with a really smart person, someone I highly respect in the community. Reading your bio and knowing more about you, serial generalist, serial specialist, you got a background, a little bit of everything, which I think is really important, but I want your narrative on that. Chiropractor, strength and conditioning, PT, etc. Do you think those are important skills for today's coach and practitioner? Meaning having and dipping your toes in each of those and having a comprehensive understanding in that?
100% I do. Whether I intentionally did it that way or not, I've always been a curious person.
Yep.
So you're coming out of undergraduate, coming out of college, curious about strength and conditioning. You pursue that route. I go into chiropractic college and still curious about strength and conditioning, but I'm also interested in, manual medicine, so to speak.
Yep.
Right. So you're going down all these rabbit holes. And then as you move along, I'm still curious. I'm going down further rabbit holes, probably too many, sometimes too deep,
Yep.
sometimes too deep. And then it leads me to where I am. And I can honestly say I don't know where I'll be in the next 5 years just because of the rabbit holes that I enjoy going into. So to answer your question, do I think it's important? I 100% do. I think aside from the curiosity piece, I think at the end of the day, whether it be with the professionals that you work with, the athletes or the patients that you work with, the coaches and management that you work for, what's most important, in my opinion, communication, understanding, right? So in order to get there, I think you need to have both experience and understanding in as many different realms as one, you're able, and two, that's within your scope, so to speak.
Sure.
And at the end of the day, I think it's helpful. I have some notes myself, but
Yep.
there's one thing that I came across a while back, and they call it searchlight intelligence. Have you heard of that at all?
I have not. Educate me.
Okay, so searchlight intelligence, the ability to discern connections across spheres, bringing people and ideas together where others see no possible connections. So let me read that again. The ability to discern connections across spheres, bring people and ideas together where others see no possible connection. So I don't know if when the last time or if at all you've been on my blog, but on the top it says making seemingly random connections across disciplines. So it's you're putting things together, and I'm sure think about you with your music, with
Yep.
your poetry,
Yep.
with your readings,
Yep.
philosophy, strength and conditioning, biomechanics. There's so many connections, right? So yeah, I think you just become more well-rounded, and then you can, at the end of the day, better able connect with the people who you're working with and working in front of.
100%. And it reminds me of actually a podcast, and I know I've plugged it many different times on this particular podcast, which is Econ Talk with Russ Roberts.
Oh yeah,
Nothing,
100%.
nothing
Yeah.
to do with strength and conditioning, performance, but everything to do. You're working in complex systems. In a lot of the books, I don't know how you are, as I've aged in this profession now, going on going on my third decade, is a lot of the books that I read now, aside from the research, have nothing to do with strength and conditioning, but literally everything to do with them. You can
Yeah.
always make those ties back. And I do think it's important. And the last thing I'll say to piggyback on that, and I've just used it more and more now, specifically with all the information coming. And it's a lesson I wish I learned earlier from Dan Paff. And he always talked about first principles. And understand your first principles. I'm like, well, what are you talking about? Programming, psychology, physiology, biomechanics, and physics. And he said, you don't have to be like deep, 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 deep in those, but have an understanding of those because those will one day create a filter on how you process all of this information coming to you. And I can tell you, there's been some aha moments for me recently that where I've had to rely on that, not like a deep, deep, deep understanding of it, but understanding those concepts. And then the
Mhm.
last thing I'll say, I don't want it to be a monologue.
No, no,
Going
no, no,
through
please.
going through a PhD process, there was a funny joke I heard from one of my colleagues, and it's hilarious. He said, "You learn more and more about less and less until you know absolutely everything about nothing." that
Oh,
right there, that right there is digging so deep you lose track of the performance landscape.
yeah. And I would agree 100% with that because, sometimes I find myself, including lately, that I'm going down all these other rabbit holes that in my head I'm thinking, oh, I still need to keep up with medicine.
Sure,
I still need to keep up with sports medicine. So, how everyone is best able to do that, I don't know. It's whether someone spends one day doing one realm, one day studying another realm, and so on and so forth. But we know that life's unpredictable.
sure,
So I think at the end of the day, as long as one is you're one day better. As long as one is
that's right.
continually moving forward, then we're all set.
Treatment philosophy. You have a unique background, right? You have your clinical work away from professional hockey, and we'll talk and touch on, excuse me, your consulting with the Edmonton Oilers. But you've got two different environments that you deal with on a daily basis. Does that treatment philosophy, first of all, what is it holistically, and then secondly, does it change based on the environment?
To be honest with you, I ask myself this question quite regularly. What is my philosophy? And I think the fact that I can't nail down one paragraph description is a good thing because it's adaptable. So to
100%.
answer your question, I'd say treatment philosophy needs to be adaptable to context, to the person in front of you, to the scenario in front of you. But overarching, I'd say from a any treatment always starts with assessment, right? Assessment of the situation, assessment of the person in front of you, both, what's occurring in their life, whether it
Sure.
be the player, the patient, whoever. So it always starts with assessment, and I think we need to spend more time um, in that realm before we even get to treatment. So from an assessment standpoint, I said this in a talk that I gave almost 10, 12, 13 years ago is know what you see, know what you don't see, know why you don't see what you don't see, and then know how to best get what you need to see.
Ha! I
Okay.
like this.
So
Yeah.
and this came from working together with a track coach. As you know, performance therapy. So you're
Sure.
you're you're there in a day-to-day environment and you're watching the athlete. Sometimes a lot of times you're not intervening because you're letting them do their thing. But with repetition over time, you'll be able to know what you see, and know what you don't see. And I think going to that first element, the know what you see, you need to study, obviously. And
Sure.
I'm preaching to the choir here, but go down your rabbit holes, get your depth, so to speak, and truly understand anatomy, physiology, biomechanics, so on and so forth. Know what you don't see. I think that's where, the width comes in, the specializing across different realms,
Sure.
right? So now you're making connections that, you know, I saw this in gymnastics, so now and here it is in hockey, and at the end of the day, we're all human. So, maybe there's some type of connection there. And then know why you don't see what you don't see. That's just, in my opinion, kind of being good at what you do, or at least trying to be good at what you do, and again, this goes back to the width and the breadth of knowledge and understanding of multiple contexts,
Sure.
and then how to get best what you want to see is keeping sharp with your skill set, understanding strength conditioning, understanding exercise rehab, manual therapy, so on and so forth. So, do I advocate for going to as many courses as you can? I would say yes, so long as it keeps you curious, doing it with intent.
Absolutely. Great
Yeah,
response. So let's talk a little bit here about your responsibilities with the Edmonton Oilers. You are a
sure.
consulting chiropractor. First of all, what the heck is that? And then give me a day to day. What does that look like for you? I know we
Yeah,
spoke off air, but I want to share that with the audience.
sure. I think the consulting part probably stemmed from the fact that prior to working with the Oilers, I was working with players independently.
Okay.
And so for 5, 6 years working with players independently, both visiting teams and some local players,
Okay.
I will pause right there and say that number one, whenever you're working with the athletes, communication is key, and obviously with the permission of the player. So I knew the training staff for a decade at least prior to working with them. And so when times were necessary where we'd have to communicate, it was very, very seamless.
Great.
So then came COVID, then came the bubble. No one was allowed in, no one was allowed out. Some players still needed some work, and so the team pretty much said, we came to an agreement. Okay, let's join for the bubble, working as part of the team, and then after that, everything went well, and now I'm still a part of the team. So I guess that's where the consulting portion comes to play. And so my daily role is I'm there every day, every morning. I come in, we have morning meetings, we do our treatments, and then typically once they jump on the ice 10:30, 11 o'clock a.m., then I skip out and head to the clinic,
Okay.
and then if there's a home game, I'll come back in the afternoon, um, help get them ready, or whoever I'm working with, get them ready for the game. Some players have routines, some don't. Stay after the game as well. Work throughout the game. Running towels, running skate blades, and so on and so forth. And I mean, at the end of the day, who else can say that they've watched 40 plus games per year, front row, Connor and Leon, right?
Best in
So
the
it's
world.
it's
Best in the world.
yeah, it's a privilege for me. And then normally I don't go on the road unless it's a last minute thing or if it's planned in advance, kind of getting ready for the playoffs, and then come playoffs, I'm all in.
That's outstanding. It leads me to a great pivot here. Talk to Mike Potenza about this management versus development, meaning management, you're managing 82 car crashes a year versus development is the off season. Also spoke to Mike Prebeg about his ideas on high performance in professional hockey. But I want to talk about the management right now. So in the season, right? And Mike Prebeg had talked about, he said, Ant, these guys are Ferraris, right? Like you don't just take a Ferrari and drive 100 miles an hour. You know, you need to be in the garage. You need to tune it. You need to make sure it's a constant tuning. I'd imagine much of this, Jeff, may be driven obviously by the player and their wants and needs. My question to you is this: from a treatment standpoint, for asymptomatic players, you're not coming back from a hip pull or nothing like that. Do you feel they should take advantage of those modalities on a daily basis, based on your opinion, or is it hey, it's just driven by the player, whether it's in their minds or not, it's going to be driven by the player? Or do you think it's that important that it should be a piecemeal part of every day for the preparation process?
I will say it's player dependent, and
Okay.
a lot of that comes from their own personal experiences.
Okay.
I mean, we do have the privilege of having an army on our team.
Okay.
So when I say that, we have 3 athletic trainers, a physiotherapist, myself, a chiropractor, a massage therapist, 2 strength and conditioning coaches, a strength and conditioning intern. So there's a lot of us. And at the end of the day, like as with any good team, there's a lot of overlap
Sure.
where a player, a new player might come in and they're like, who the heck is who, but that's a good thing because there's an overlap in skill sets. So I would say, yeah, maybe 80% we can all do the same thing. And then the 20% is where we specialize, manipulation myself or needling a few of us, the three or four of us needle and all in different ways. Massage therapist has his massage, but he's also stretching, performing exercises, and so on and so forth. Our strength guys, them, Chad and Joel, they do a lot of the rehab too. So now going back to your question, I will say that a lot of young players are still pretty sheepish about getting on the table. There's the whole bottom of the ladder, seniority, so on and so forth. But I would say it's incumbent upon us to go out of our way to show them the ropes. Say, yeah, sure, you only had one person in junior or in college, or maybe even students in college. You're in the show now, so we're here to help,
Sure.
right? So to truly answer your question, I think at the end of the day, it's up to us as a staff to go out of our way to make sure nothing is underlying. So I think at the very least, everyone should have whatever routine that works best for them from an assessment standpoint, whether it be tabletop assessment, movement assessment, so that they're, going back to knowing what they see and knowing what they don't see,
Sure.
and then it's okay. So let's say we check their hips, we scour their hips, we check their ankles. Ankles are very, very or underappreciated in hockey. They're stuck in a stiff boot, right?
Sure.
Relatively stiff boot. So it's up to us to do our checks daily. And how many times, I can't tell you how many times, where we'll do a check. Okay, you're good to go. Go train, right? Or jump on the ice. But then there are times where, oh, okay, let's work on this. Let's just get it better. I'd say a good maybe I'm not accurate here, but a good 60, 70, maybe 75% of the work we do, if not more, is asymptomatic, right? It's not that and I know people will say, okay, you're creating dependency. These are pros. They're making a lot of money. There's a lot of money on the table. There's a lot of money at stake. So at the end of the day, we have to do what we think is best for them. We have to make sure that they're going into any training environment, any game as healthy as possible. And then most importantly, along with that, going back to the dependency piece is how we communicate. So,
100%.
are we telling them, "Oh, you're not gonna be able to play because of this," or are we saying, "I don't know, this is we're just lubricating things. We're just allowing things to move better." To go off on a tangent a little bit, that's kind of my thing about you want things to move as well as they can so that there's optimum adaptability, so to speak, right? If not, you're just driving the car with the e-brake. Yeah, so sometimes it's, for a certain player, it might be hands-on therapy. Another player, it might be hands-on combined with exercise. Other times it might be just exercise rehab, warm up, whatever. But I do think for asymptomatic individuals, it's important to at the very least do our checkups, do our tune-ups, do our bi-yearly dental checks, so to speak, or getting our oil changes, even when nothing's perceived to be going
Uh,
wrong.
Agreed completely. And the analogy, I know one's complex, one's complicated, but the analogy by Mike, that Ferrari analogy, makes perfect sense. And whether the engine needs tuning or not, it's good to be able to make sure when it is on the road, it's driving optimal. Um,
And Mike's a great guy. I mean, I spent a week with him last summer, because some of our guys see him. So
sure,
like there's no competition here. It's how can we best provide services for the players that we mutually see.
sure.
There's no question why the players love him because at the end of the day, what he does best is give the athletes what they need and the trust.
This episode has been brought to you by the High Performance Hockey Masterclass. The High Performance Hockey Masterclass is a comprehensive lecture series exploring the science and practice of high performers in the sport of ice hockey. It was designed and created and engineered by myself, Anthony Donskoff. It is an 8-part lecture series that includes metric fixation, the tyranny of metrics, reading research, what matters, going back to get my PhD as a 40-year-old, how do you target your readings in terms of digesting, accumulating, and reading your research, biomechanical considerations for ice hockey, the adductor magnus, how we program hip health during the off-season and in-season, the Gain, Go, Grow model, this idea of a 3-day rollover program for high-performance hockey players, considerations for the in-season, how to manipulate that model for high performers, our communication structure within the confines of Donskoff strength and conditioning, and finally, the fast and frugal tree, considerations for return to play. More information on the High Performance Hockey Masterclass can be found at anthonydonskov.gumroad, GUMROAD.com. Thanks for listening. Communication, obviously, like we talked about, understanding the complexities and digging deeper into being great at what you do, but the communication is so important as well. I want to stay with this idea right now of management and specifically the in season. Probably one of my favorite quotes by Yogi Berra. In theory, there is no difference between theory and practice. In practice, there is. So you might be able to give me a textbook answer to this. You might be able to say, Anthony,
Sure.
throw that all out, and this doesn't happen. Keep the
Sure.
high days high and the low days low. Are there certain modalities after a game where you want to complement the stress from a recovery standpoint? And then on days off, do you use different modalities, more parasympathetic in nature, to get your regeneration periodized, if that makes any sense?
Sure. Yeah. I will say that I think we should all have some form of guiding framework. And then at the end of the day, life and everyday scenarios come at you, and you might need to pivot, if you will.
Okay.
But at the end of the day, we should have a guiding framework. So I remember a couple years ago when we had our weekly summer talks, strength and conditioning summer Zoom
Yep.
calls
Yep.
with with COVID happening. I gave a short one about periodizing manual inputs. So
Yes.
you have your performance therapy, you have your intensive input, you have your extensive input, and then you have your restorative input. So performance therapy, most people are familiar with. That's your F1 fine tuning, asymptomatic individuals, and you're just trying to maximize not only adaptability, but I would say afferent ability. So you have afferent and efferent, right?
Sure.
So it's joint proprioception, if you will, whatever. So the performance therapy piece, whether it be joint pumping, manipulation, soft tissue work, or any other modalities, so to speak. Picture this. Can you download Instagram on an iPhone 3? Probably not. You need a system, iPhone 15, iPhone 14, iPhone 12, if you will, but you can definitely not do it on an iPhone 3. So why not, quote unquote, make the human body system functioning like an iPhone 15 rather than an iPhone 3? Or if someone wants another way to picture this, is you're driving on the highway, it's a snowstorm or a rainstorm. Are you going to be able to drive with a covered up windshield? No, you got to clear everything out first so that
For
you
sure.
can react and respond better. So that's our performance therapy piece. The intensive piece is pretty aggressive. Doesn't have to be, but often, your ARTs, that can be relatively aggressive on the athlete. Sometimes manipulation, sometimes deep tissue massage. Extensive therapy is, your prolonged work, can be intent, can be aggressive, so to speak. And then your restorative is, a relaxing massage, a warm bath, and so on and so forth. So going back to your question of can we periodize them or should we high days high, low days low? I would generally say that, your restorative piece, you probably want on your low days. The system needs to be low. So you restore that. Your high days, you probably want to best do your intensive soft tissue therapy, other manual treatment sessions on those high days. And again, this is a guiding framework. This is when
Sure.
everything is perfect, so to speak. The extensive work always post session, and taking into account what the next days look like. So, is there a game the next day in the afternoon? You probably don't want to be extensive, or do they have a couple days off? So, I would say at the end of the day, whether it's periodization or not, at the end of the day, you have to keep in mind what is occurring contextually. What's their schedule? Have they played back to backs? Do they have a couple days off coming up, or is it, you know lately we've had our schedule where it's game on, game off, game on, game off. That's
Tough.
in our it's tough, but it's relatively routine.
Mm,
Right? It's relatively routine. So, I don't wanna say it's easy, but it's less tough from a planning standpoint in terms of what you're gonna do therapy-wise.
got it.
Yeah. So, it's those days where, you go back to back, couple days off, game on, game off, game on, back to back. So that's a little bit more difficult from a planning periodization of a treatment standpoint. So, at the end of the day, that's where our ability to kinda think contextually, think broader, think on the fly, be adaptable, that's up to us.
Educate me, if you will, on this. So you've got a toolbox. You have an intensive. You got a performance, extensive, and restorative, and you've got your modalities. I'm sure this happens, right? An athlete or a player wants something on a day that should be restorative, and they want it intensive. I'd imagine, it's a cooperative approach. You're going to give them what they want, but is the end goal to try to educate as you go and say, hey, this modality, great, and here's why we're going to do it. But having said that, you just came off a game, and these are some other modalities to consider at the National Hockey League level. I know it's a cooperative approach, and most of it's going to be driven by the player. But do you have that opportunity to continue to try to educate as you go?
I would say yes, and here's my reason why. When it comes to, you know, the the best of the best, a
Mm,
common thing that I hear from them, it only turned the light on in my head relatively recently, maybe in the last year and a half to 2 years, is, of course, the thought is, it's a collaborative approach. But very often I hear the best of the best players say to me or say to someone else on our staff, whenever we approach them and say, "Okay, what would you like to do today?" They often say, "I don't know, you're the professional." Right? So
yep,
it's,
yep,
we have to come ready. And
sure,
is it collaborative? 100%. But we should always come to the table with a plan in mind. That's that's pretty much how I would answer that. Um, and then, that goes hand in hand with communication piece amongst staff. We have our morning meetings. We generally prepare. If it's not someone that we routinely see, we go through all the players and we say, okay, well, what's best for this person for this day? What's best for that person for that day? And so on and so forth. So I'd say it's collaboration, but we better come ready.
absolutely.
Yeah.
Gaps in the high performance model. I say gaps, opportunities, maybe a better word, right? You look at relatively in the National Hockey League, this high performance culture. We're kind of borrowing from professional soccer, and we're getting our high performance departments. Now we've got our strength coaches, as you mentioned, scaling your teams out. From a holistic standpoint, do you feel there are opportunities that the NHL in professional sports where we're still lacking, we need better understanding of? Or do you feel like, hey, we've really come together in terms of creating a high performance model? Understanding, by the way, that I know it's different for every hockey team, if that
Yeah.
makes sense.
Yeah. Yeah. I guess I would answer this first by saying I'm not sure if there is an ideal or perfect model. And the reason why I say that is because if there are so many different kinds of models that exist and exist successfully, how can there be a perfect model?
Very well put.
you know, what I would say is that, you know, and I'm not trying to toot our own horn, But when players come to our team, whether it be via trade or free agency, a lot of them are pleasantly surprised with what we have going on. And I would say, in large part, that's because we have diversity within our room from staffing perspective, and we have communication. So, with our medical meetings every morning, the strength staff are there as well. So we are one and the same. I don't consider them. I mean, maybe on paper they're considered different departments, but we're one. We're one unit, cohesive unit. What I would like to see more, based on what I've heard in the room and around the league, and this is specifically for hockey, whether it be professional hockey or even amateur hockey, is I would like to see more personnel, because at the end of the day, it's let's say junior, it's a one man show, equipment slash medical guy. Um, in college they have their main trainer plus students. I could be wrong. Uh, in the AHL, we have on our team specifically, we have a couple equipment guys, uh, and two athletic trainers, athletic therapists, maybe an intern. But we spend so much money on the players. We need to spend, in my opinion, we need to spend more on the support staff to support the players. So before any quote unquote perfect model, I think we need to focus on getting quantity and quality staff in place to provide this quote unquote ideal model. So I know other teams have, at the end of the day, you need a minimum of two athletic trainers, um, maybe a physio, maybe a massage, but I don't know, why not have all of them? As long as you have the right people, why not have all of them? And so we're very fortunate that we have an army, and if one's sick, then it's business as usual. So I think, uh, at the end of the day, my answer would be, if we can, just build up the staff within each team, um, from a diversity in terms of specialty, as well as obviously quality and quantity. I think that would help make whatever performance model, whatever health model they have, thrive much better. The reason why is because, as you know, a lot of players have their independent guys. So initially, my first thought is, what does that tell me? That tells me that the team may or may not be providing what the players need, right? That's the reality of it. I will say, from experience, that sometimes players just need to get some treatment outside of the room, just to clear their mind, and just have someone they have trust in from a consistency standpoint over the years. I will say that I think that's very important. But I would say, if more players they have their independent guys, or what they call in Major League Baseball the bandits.
Yeah. Yeah.
And I would say I'm one of them, because in the off season I do treat players on other teams. But I think if we collectively all did a better job within, then I think the players would be taken care of a lot more.
Excellent. And a common thread that you have spoken about throughout the course of this, I think perhaps it's my age and being involved in strength and conditioning performance, as well as just how crucial the communication is. I mean, to me, I spent, from a personal standpoint, the first decade and a half of my coaching career involved in the intricacies of, periodization, physics, whatever it may be. And you realize the more and more and more you're in it, is that if you cannot communicate that, it doesn't matter how great you are at the knowledge
Yeah,
base. It's really tough to get buy-in, and buy-in is trust, and trust is execution, and execution hopefully leads to some sort of results. But if you don't have that great communication, both inter and intra, from the staff and from the player, it's difficult.
yeah, yeah. And unfortunately, these days, a lot of it's selling.
Mm. Mm. Yeah.
But yeah, I think you know, it's almost a given. Like, even if it's just a small little heads up with, hey, this is what I think is going on, or do you see this? And communicating without an ego, it just makes it that much more special.
100%. Pivot here, medical. Tracking and managing injury audits postseason. Is there something where you're looking, from an anatomy standpoint? Are you tracking these injuries? Hey, we've had X amount, and this is the region, or this is the mechanism of injury. Is the performance staff, and I'm throwing a lot of questions at you here. Are you
Sure.
ranked and measured on games lost or man games missed? I know you had
hmm
mentioned you have a weekly meetings. Is that something that you do postseason as well to tie that up and look at, the season as a whole?
Yeah, I'd say I think I might have a couple answers for you. Um, so yeah, from a day-to-day basis, we have our daily meetings, and then I would also say that Chad and Joel, our strength staff, they do profile each individual athlete with all their different
Okay,
metrics, so to speak, all the testing that they do.
sure.
Whether it be through their jump testing, their catapult information,
Mhm.
their coinciding with our preseason, you know, medical and fitness testing. Each player does get profiled, and they're communicating with the players quite a bit with where they're currently at, where they would like to see them, and so on and so forth. I would also say that the league itself is very on the ball with respect to their injury history. So they record all of that. And so anything that we input into our charts, so to speak, gets saved onto the NHL database. So if a team doc is communicating with one of the players and they need to know more information, and all of this gets revealed both pre and postseason medical testing. And then on a somewhat regular basis, we're always, I would say, communicating, whether it be on the fly, on paper, with data in front of us, with how can we better serve these athletes and serve these players and get them to a state where they can perform better. And I would say, with regards to, obviously there's this site, Man Games Lost, I think mangameslost.com or whatever it is. I would say I just generally don't think that that shows the big picture, because if we're holding out someone because they're not ready yet physically, yet they can play, or vice versa, you know, they can't play, but it's playoffs. Like that's not telling the whole story,
Whole story.
right? So I get it. That's something for people who are interested in knowing
Yep.
to dive deep into. But I would say there's definitely more than meets the eye when it comes to all the information that's out there, and hope but I would say hopefully each individual team is doing what they need to do to keep their players moving forward. Um, so in a nutshell, I think it's very helpful that our strength guys are testing on a somewhat regular basis. They're always trying new things, obviously with the permission of the players, taking all the different measurements. Those two, Chad and Joel, they're unsung heroes, and they definitely don't get enough recognition and credit. Especially Chad, for someone who doesn't want to spend time on social media, right?
Yep.
But I think he does have a lot to share.
We were lucky enough to have both of them on the podcast. Great human beings and fantastic, practitioners. Are there any objective measures from the medical staff that you look at and measure? Maybe you're not able to share those. You mentioned the performance numbers. Is it something where during baseline testing during the season, maybe it's a Y balance, it's kinemat, whether it's goniometers? Is there anything that you look at that you're able to reference? And if you're not able to share that, I understand, but
Sure.
maybe it's a yes or no answer.
Um, I would say it's always evolving, because
Okay.
there's the ideal, and then there is what's realistic, I would say, we probably throw more testing measures during development camp because we have more
Yes.
time and less players.
Sure.
When it comes to training camp medicals, and you have 70 plus players, and these guys want to just get in and get out and get on the ice.
Yeah. Yep.
There's only so much you can realistically do, and what we found that with some of our testing, we have done Y balance, we have done FMS. I would say, I would have no problem saying that what we do now is probably a combination of, from a medical musculoskeletal movement standpoint, we do a combination of bits and pieces of each based
Yep.
on what we think
Yep.
is most appropriate for the sport. Um, but what we found is that if a certain test or a certain assessment, if everybody gets flagged or nobody gets flagged, what's the point of doing it? Right? You kind of want the assessments or testing procedures whereby, you know, some are flagged and some aren't, and well, why aren't they and why are they? Right?
Look at the
So
outliers, right? On each end.
yeah, yeah, 100%. So it's definitely evolving. From a physical fitness standpoint, you have your staples, jump testing, force frame, um, conditioning, and so on and so forth. But I would say even probably more important than that on a day-to-day basis is the touch points that you do from going back to your question about getting treatment or using modalities when they're asymptomatic. I think that tells us a lot more than a random one day fitness
100,
test.
100%. I don't know how you are as I've aged. I know my testing battery has shrunk considerably, to the point where, number one, what's the strongest relationship to on ice speed? Okay, what are those? Can we test those and make them part of the training process? Can we also test those without wear and tear on the athlete? These, can we use those numbers as baseline? These are all things that, as I've aged, I've thought about critically, and as a consequence of which, my testing battery, for lack of a better word, looks more like my hairline now than it used to. Like, right? I had a bunch of stuff. It's just
Yeah, yeah.
interesting, and then you realize a lot of this stuff before, it's debatable. Many of them, in terms and measures of how important they are for on ice performance to begin with. So,
I will say though, there is a process that we all have to go through as we move up in ranks or move along the way throughout our professional career, that going through all of those are important. Obviously, if we have the resources, the time, and the opportunity to go through those testing batteries to then find out what we truly need, you know, because if we just went straight to the goods, we probably don't have that opportunity to accumulate the knowledge and understanding of what we just went through to get to the point to really using what we actually do use. Yeah, I think there is a beneficial process to going through all the different testing batteries at some point along our careers to know what we know, and to then know what we don't need to know.
completely agree, and I strongly, strongly endorse that message. I'm glad we did that, or I'm glad I did that as well. And those aren't mistakes to
Yeah,
me; those are lessons. And by the way, I look at our
100%,
testing battery, and those might be trimmed down and changed as I learn more. Right? Okay.
100%.
Final pivot here. Advice to young practitioners. Rewind your career back. You're starting now. What advice would you give yourself?
Do exactly what you just did for the last 20 years. That's my personal advice to myself. I might be long-winded here, but when I just started chiropractic school in 2002, I was asked if I wanted to work with a AAA hockey as a student trainer. And so I said, yeah, sure, absolutely. You're my mentor, so of course I'm going to say yes. I don't have critical thinking yet. So I did that all along school, when I graduated, so on and so forth. minor hockey players, AAA hockey players. Coincidentally, some of those players are now pros or have retired. I've re-met them along the way too, in these ranks here too. So I would say start as early as you can, get your hands on as many athletes as you can, and on as diverse sports as you can. So I can't say it enough how important, volunteering your time is. And, whether it be manual therapy or strength and conditioning, it's no different. Like, coach as many kids as you can.
Sure.
If you're on the soccer field with pylons and medicine balls and whatever you have, coach as many athletes as you can. But from a therapy standpoint, it's someone can be book smart, but the patient or the athlete will always know who's got good hands. And the only way you can get there is by getting your hands on as many people as you can. So I would start with that. I would also say I don't know if you can teach this, but be as curious as you can.
I'm
Aim
finding that,
for
sorry to interrupt you, but I'm
Yeah,
finding that
please.
as I've aged, I don't know if that's something that can be taught. I say that, and I say it respectfully. Like, I meet young interns at our facility. I'm like, wow, that's a passionately curious person.
Yeah,
And then on the convert, the other side, I see it. Okay, well, they're going to do just as much as they can, and not more in terms of the take home work to get done. I have found the most interesting people that I'm able to speak with are autodidacts. They're a combination of educated people, but constantly asking why, until it almost gets to be a pain in the what, right? Like, why? Well, how
sure,
did that happen?
sure.
Why? And you
Yeah,
get to these points, and I say self-taught. I just mean that they're constantly into something, trying to better
yeah,
themselves.
yeah,
I don't know. I don't know if that can be taught. I used to
yeah.
think that could, and as I've aged, I think I don't know. Maybe that's just something. Maybe that's just something built into that person or the environment in which they were raised. I don't know that.
Unless you have, perhaps, with your setting, you have a requirement of your interns that, Charlie Weingroff, his thing is, I read a book for myself, I read a book for you, and I read a book to get away from it all. Right? So, one for myself is, professional development. Um, One for you is also professional development, but in a slightly different realm.
Yep.
And then one to get away is fantasy, his Disney or whatever. So if there's a requirement of like that, maybe you can teach it. Who knows? I think we should all have a hobby,
Big time.
whatever it is, whether it be cigars or writing poetry, woodworking, whatever. I think at the end of the day, the more you're outside your realm, the more beneficial you can be within your realm. So, going back to our discussion about, serial specialist, or there's a book called Neo Generalist.
Oh, I love it. Yep.
Um, yeah, Kenneth
Great book.
Nicholson and Richard Martin. And they say if you live in more than one world, you tend to see more than one way. You tend to see in more than one way, right? So find what it is that lights your fire, and it doesn't have to be with regards to what you do on a daily basis, but it will enhance what you do.
Our guest today has been Dr. Jeff Cubos. Jeff, thanks so much for joining us.